Vitamin D is now considered all over the world as playing a crucial role in health. This is true for the musculoskeletal health. Musculoskeletal health involves the bone, the joint, and the muscle. It has been clearly demonstrated that sufficient levels of circulating 25-OH vitamin D are needed to prevent against osteoporosis and more specifically to reduce the risk of all fractures, but also of the most important fracture, which is the hip fracture. Vitamin D has always been shown to be extremely important for muscle health. And we know that people who have a deficit in circulating levels of vitamin D have also a decreased muscle strength, leading to an increase in the risk of falls. So the combination of a poor bone and a high risk of falls is clearly leading to an increased risk of fractures. In osteoarthritis, it has also been shown that people who undergo a total joint replacement at the hip or at the knee have in average lower circulating levels of vitamin D. Outside of the musculoskeletal health, it has also been demonstrated that in women at the age of 80 and over, the survival is lower in those who have chronically low levels of vitamin D compared to those who have normal levels of vitamin D. There have been several other body systems where vitamin D levels have been shown to be requested for health. For instance, there is a clear interaction with vitamin D and cardiovascular health, or with vitamin D and diabetes. Everywhere, if not the fact to increase the levels of vitamin D above a higher threshold which is needed, is to have normal circulating levels. Now, do we have enough vitamin D? Clearly not. In most of the European countries, including Italy, the percentage of the population who is showing a deficit in circulating levels of vitamin D is above 50%. And that's not surprising. Vitamin D comes predominantly from two sources: sun exposure with transformation at the level of the skin, and intake of food. But the food which are providing vitamin D are not that many. They are mainly the fatty fish, as the well-known cod liver oil that was given to the children for decades. But if you want to have sufficient levels of vitamin D in your body, you need to eat up of 600 grams of sardines or mackerels per day, which nobody does. And if you want to have it from the vegetables like the mushrooms, you need to eat 2 kilograms of mushrooms every day, which nobody does. Which means that today, all the scientific societies around the world, in Europe and outside of Europe, like in the United States, strongly recommend to have an exogenous administration of vitamin D if there is any risk that the patient doesn't have enough. And the recommended daily dose supplemented is 1,000 international units per day. And if the people prefer to have a supplementation once a month, which might be more convenient, hence increasing the adherence to treatment, there are vials giving 25,000 a month. So you can give either 1,000 a day or 25,000 a month, and with that, you will decrease the risk of many disorders, including osteoporosis, sarcopenia, and osteoarthritis.